What diseases are so terrible that dying would be preferable? Rabies. It's exceptionally common, but people just don't run into the animals that carry it often. Skunks, especially, and bats. Let me paint you a picture. You go camping, and at midday you decide to take a nap in a nice little hammock. While sleeping, a tiny brown bat in the rage stages of infection is fidgeting in broad daylight, uncomfortable and thirsty due to the hydrophobia. You snort, startling him. He goes into attack mode. Except you're asleep and he's a little brown bat, so weighs around 6 grams. You don't even feel him land on your bare knee and he starts to bite. His teeth are tiny, hardly enough to even break the skin, but he does manage to give you the equivalent of a tiny scrape that goes completely unnoticed. Rabies doesn't travel in your blood. In fact, a blood test won't even tell you if you've got it. Antibody tests may be done, but are useless if you've ever been vaccinated. You wake up none the wiser. If you notice anything at the bite site at all, you assume you just lightly scraped it on something. The bomb has been lit, and your nervous system is the wick. The rabies will multiply along your nervous system, doing virtually no damage and completely undetectable. You will literally have no symptoms. It may be 4 days, it may be a year, but the camping trip is most likely long forgotten. Then one day, your back starts to ache, or maybe you get a slight headache. At this point, you're already dead. There is no cure. The sole caveat to this is the Milwaukee Protocol, which leaves most patients dead anyway, and the survivors mentally disabled, and it's seldom done. There is no treatment. It has a 100% fatality rate. Absorb that. Not a single other virus on the planet has a 100% fatality rate, only rabies. And once you're symptomatic, it's over. You're dead. So, what does that look like? Your headache turns into a fever, and a general feeling of being unwell. You're fidgety, uncomfortable, and scared. As the virus that has taken its time getting into your brain finds a vast network of nerve endings, it begins to rapidly reproduce, starting at the base of your brain where your pons is located. This is the part of the brain that controls communication between the rest of your brain and body, as well as sleep cycles. Next, you become anxious. You still think you only have a mild fever, but suddenly you find yourself becoming scared, even horrified, and it doesn't occur to you that you don't know why. This is because the rabies is chewing up your amygdala. As your cerebellum becomes hot with the virus, you begin to lose muscle coordination and balance. You think maybe it's a good idea to go to the doctor now, but assuming a doctor is smart enough to even run the tests necessary in the few days you have left on the planet, odds are they'll only be able to tell your loved ones what you died of later. You're twitchy, shaking, and scared. You have the normal fear of not knowing what's going on, but with the virus really screwing the amygdala, this is amplified 100-fold. It's around this time the hydrophobia starts. You're horribly thirsty, you just want water, but you can't drink. Every time you do, your throat clamps shut and you vomit. This has become a legitimate, active fear of water. You're thirsty, but looking at a glass of water begins to make you gag and shy back in fear. The contradiction is hard for your hot brain to see at this point. By now, the doctors will have to put you on IVs to keep you hydrated, but even that's futile. You were dead the second you had a headache. You begin hearing things, or not hearing at all as your thalamus goes. You taste sounds, you see smells. Everything starts feeling like the most horrifying acid trip anyone has ever been on. With your hippocampus long under attack, you're having trouble remembering things, especially family. You're alone, hallucinating, thirsty, confused, and absolutely undeniably terrified. Everything scares the literal crap out of you at this point. These strange people in lab coats, these strange people standing around your bed crying who keep trying to get you to drink something, and it's only been about a week since that little headache that you've completely forgotten. Time means nothing to you anymore. Funny enough, you now know how the bat felt when he bit you. Eventually, you slip into the dumb rabies phase. Your brain has started the process of shutting down. Too much of it has been turned to liquid virus. Your face droops. You drool. You're all but unaware of what's around you. A sudden noise or light might startle you, but for the most part, all you can do is just stare at the ground. You haven't really slept for about 72 hours. Then you die. Always you die. And there's not one freaking thing anyone can do for you. Then there's the question of what to do with your corpse. I mean, sure, burying it is the right thing to do, but the freaking virus can survive in a corpse for years. You could end every rabid animal on the planet today, and if 2 years from now some moist, preserved, rotten hunk of used-to-be brain gets eaten by an animal, it starts all over. So yeah, Rabies scares the crap out of me, and it's freaking everywhere. Source: spent a lot of time working with rabies. Would still get my vaccinations if I could ever afford them. It makes sense this is the first one in the thread, huh? I feel like rabies and koalas are the two things with those big info dump, pretty well written posts. Koala one, a little more humorous for sure, although I think filled with a little more misinformation than the rabies one, from what I remember. But I've seen this exact post maybe 5 times, and I'm sure you all have too. But it's a good reminder, if you are camping or otherwise spending time with animals who you might not know the state of, rabies-wise, just be careful. Keep it in mind. It's definitely very dangerous. Hopefully this whole thread isn't just posts about rabies. I think Reddit was on botulism for a while too. I mean, like, posting about it. We'll see if that shows up. Next story. Fibrodysplasia ossificans progressiva, FOP. Basically, your body heals all injuries with bone. Tiny muscle tears, cuts, etc. Basically slow, painful petrification as the tiny bone spears cause further damage to surrounding tissue, causing more bone growth, causing more injuries, etc. At a certain point, you get to decide if you want to spend the rest of your miserable existence laid down or sitting, because you're going to lock in that position. Next story. Radiation exposure and poisoning. There was a case of radiation poisoning in Japan in 1999 where the patient was deteriorating/disintegrating on the hospital bed for 83 days after radiation exposure. His skin and internal organs broke down. He had diarrhea and dehydration. Blood was leaking from his eyes. He was leaking fluids. He could no longer eat after 2 weeks, and they couldn't administer anything intravenously due to his tissue and cells being unable to repair or even hold themselves together. He had regular heart attacks as well, to which he was revived frequently. The patient's name was Hisashi Ochi. Next story. EB/butterfly syndrome. Skin so fragile you can't touch it, like the wings of butterflies. Constant bandaging, which can cause the tears and blisters that it's trying to protect from. Constant worry about infection and what body part is going to be mutilated from scarring. Constant severe pain. In some cases, it affects the digestive system, respiratory system, urinary system, and genitals. It can be fatal in cases where scar tissue or blisters have destroyed organs or left the areas too narrow to function. Lungs, esophagus, and obviously sepsis. Next story. It's not a disease, but if you get stung by a gimpy plant, you will probably wish you would die. It's described as the most dangerous plant. Long-lasting sting can last for months, extremely painful pain that feels like being burned by acid and electrified at the same time. Description by scientist Marina Hurley, and the pain can be reactivated when taking a shower. It's known that a man took his own life after being stung because he couldn't withstand the pain. Next story. Tetanus. Get a deep cut from something with Clostridium tetani, not just rusty nails, literally anything that has been in direct contact with contaminated soil like ever, and you're not vaccinated? Enjoy your unpredictable spasms so violent they can literally fracture bone. Not as bad as, say, rabies, since you can survive tetanus so much more reliably, but boy howdy you will wish you didn't. Shout out to modern medicine. Please get your tetanus shots. Please get your rabies shots. I mean, wait, are those available? I don't remember ever getting one. Do I have a rabies shot? Did you guys get a rabies shot? Tell me in the comments so I know if I need to go get one or something. I really don't remember. Anyway, medicine's great. Don't spasm uncontrollably. Next story. Terminal cancer. My mom begged for death often, and seeing her mood lift almost overjoyed when the doctor said we can't do anything else put into perspective the idea of quality of life. When you're in constant misery, death seems like a gift. Sort of unfair to hurt so bad you're happy to die. Next story. New to healthcare and asked a coworker from the Philippines what the worst she's seen is. She said she has a patient that contracted HIV and as a result of lowered immune system, contracted something else that made these blisters form all over their body and have a constant fever. She said the blisters were extremely painful and would regularly pop. She said he begged for her to end him, but they don't do comfort care in the Philippines, so he just suffered till he died. She said she can still see his face. And that's when I realized you don't ask healthcare workers that crap. Next story. Dying or not being born with it? Cystic fibrosis sucks, and I would have rather not been born at all if I had the choice. Most CF patients suffer a lot of lung hemorrhaging of the lungs in their youth and as adults, amongst other issues such as gallstones, diarrhea, constipation, COPD, bronchiectasis, hearing loss, antibiotic resistance due to constant antibiotics, etc. And the new drugs are not a cure at all as they have a lot of side effects, with some having serious mental health side effects. And if you stop them, you basically get much worse or die. And the drugs cost like $300,000 per year, unless you have free Medicare or equivalent. Next story. Parkinson's disease. My mom was diagnosed with it in 2004, and 20 years later, she's in stage 5, which is the last stage. Mom went from being able to walk, drive, cook, standing long periods of time, dressing herself, using the toilet, and doing everything on her own, to being bedridden with atrophied legs, unable to hold an eating implement to feed herself, and having to be changed when she soils herself. It is absolutely awful, and I don't wish it on anyone. I was lucky to have her at my wedding 4 months ago, and days after my wedding, she ended up in the hospital, and she's now in a nursing home. My dad is currently setting up Medicaid to have her there permanently due to her condition worsening. It destroys me seeing her in that bed, unable to move or do anything. She can still speak, and she still has her loving heart and sense of humor intact. It's a very hard pill for me to swallow, knowing she's probably going to pass away one day in this facility from natural causes due to PD. It breaks my heart because she probably won't be a part of my sister's wedding if she ever finds a man and settles down, or my brother's wedding if he marries one day. I don't know how my dad will be able to handle losing my mom. He loves her so much, and they've been married almost 39 years. This is one that scares me the most. I'm pretty sure this is a common sentiment, but the idea of losing control of my body is horrifying. I don't think I ever want to be in that situation. Being unable to do things I used to be able to do or want to be able to do just physically and normally would be torture, and I do not want that. But as I said, I'm sure that's a pretty common sentiment, actually. Next story. As a student in the medical field, I had a brief and unexpected exchange with a neurosurgeon on this topic. A patient came in after falling down a flight of stairs and was in bad shape. The doctor was leaning forward in his chair, twisting a pen in his mouth with one hand and scrolling through individual slides of the patient's MRI scan with the wheel of his mouse in the other. Suddenly, he stopped, sat back in his chair, tossed the pen onto his desk, and let out a huge sigh. What do you see? There are 3 things in this world that would make me reach for my top shelf bourbon and my 357. ALS, glioblastoma, and this. And he pointed to the computer screen. I probed further. What is it about this that would make you want to do that? You see that dark area? That's blood, and it's not supposed to be there like that. What I have to do is remove the top of the skull and suction the coagulated blood. Okay? Blood stains gray matter. I still don't fully understand. I won't know if I'm suctioning blood or brain during the surgery. Oh, crap. Oh, crap is right. Next story. Lou Gehrig's disease. You wither away, and there is nothing you can do to stop it. In the last stages, you can only communicate by moving your eyes, since your muscles and nerves no longer function. When the muscles and nerves to the respiratory system shuts down, you die. Next story. Epilepsy. I have mild cognitive impairment, if you can even call it that. I can forget the content of a video I watched the previous night. My right shoulder has been dislocated 14 times. From my experience, it is more painful than a broken rib, but I'm not a candidate for surgery because I have breakthrough seizures. And one of the medications I'm on is a sloshed drunk simulator that also gives me dreams based on real life that are so vivid that I wake up disoriented. Oh, and I think it also worsens my memory too. Epilepsy eventually leads to dementia, and I'm only 23. Physically, I'm lucky that I've only had dislocated shoulders, a broken rib, painful canker sores from biting my tongue that make it hard for me to enjoy my favorite foods, and a scar underneath an eyebrow from when I had a tonic-clonic seizure when I lived at a place where the bathtub was in front of the toilet. A piece of advice for all of you: screaming will not move you up the triage list or speed up the process of your treatment when you're in the ER. Next story. Talking from personal experience here, and this may be an unpopular opinion, but chronic illnesses that obviously affect one's life and limit the quality of it. I have aggressive Hashimoto's thyroiditis, which has destroyed my ovaries and pancreas. Hormonal medication makes me even worse, and I developed insulin resistance due to a progesterone supplement. I'm taking way too many meds to regulate my body and to keep it working, but it's just not happening. I got sick around the age of 16, and my autoimmune disorder developed extremely fast and in a devastating manner, which is really unlikely for Hashimoto's. I have bipolar disorder as well, which first started when I was around 13, so I've had it rough. I only got diagnosed with bipolar a couple of years ago, and now I'm well. In fact, this is the only med concoction that has actually done me good. I've also had chronic insomnia, which is bad, really bad for the body and the hormones and all. But do you know what isn't right? My health. Even now that I'm in a good state of mind, I would pick death in a heartbeat. I can't take it. It's been almost 30 years of issues. Some will argue and belittle my health problems, but they've never tried living with them. It's different from person to person, but my body decided to get the worst of everything. I have no quality of life, no autonomy of my own body. It changes drastically within the same day. It fails over and over again, and it never does anything right. My brain is holding on just barely. It's been already too stressed by the chronic bipolar episodes. I am tired. My life has been crumbling down for years now, and so am I. Nothing that I do helps. And so here it is. It doesn't have to be cancer or a dangerous genetic disease to be so horrible. There's also people like me and others that even though we seemingly have less dangerous disorders, we still have almost zero quality of life. And it hurts, and it's exhausting, and I've started young, so this isn't going too well. I know that. And therapy that minimizes symptoms usually doesn't work, and it obviously doesn't stop the deterioration of the body due to its illness. And now I'm getting screened for rheumatoid arthritis. Way to go. I can't live my life or do anything anymore. I'm done. Reading posts like this, it's hard to believe that some people aren't just the unluckiest on earth, you know? That some people were just singled out, picked by the powers that be, and told that they are not going to have a good time. Maybe some people would see the positive or a rationalization for this. I don't know, some people might even say you've been evil in a past life. As for me, I think I would just say that you are horrendously unlucky, and people who have been horrendously unlucky have nothing but my sympathy. Next story. Severe myalgic encephalomyelitis, aka chronic fatigue syndrome. Research has proven beyond reasonable doubt that it's a serious medical condition with bleak prospects of recovery, but most people think it just means you're a bit tired or lazy and has a tortured history of being misclassified as a psychological illness. Severe sufferers have a miserably limited existence with constant pain and inflammation throughout the body, particularly the brain. There are only a small number of experts in the condition, and most medical professionals are ignorant about it and will gaslight patients. The public at large has no sympathy. Many folks who've had other serious illnesses, including cancer, say the lived experience with severe ME/CFS is far worse. Next story. Myalgic encephalomyelitis is extremely debilitating and comes with almost zero support from healthcare providers or empathy from society. Getting disability assistance is also a crapshoot. We still don't have a definitive answer as to how it occurs. No reliable treatment strategies and no cure. Just recently, a graded exercise protocol was overturned. That study permanently increased severity in thousands of patients, and I would argue set back research many years. Next story. ME/CFS, also known as myalgic encephalitis/chronic fatigue syndrome. It is a post-viral illness that damages the immune system, and one of the most common symptoms of it is crushing fatigue so intense. At its most severe, people become unable to sit up in bed. They can't tolerate light or sound, or chew and swallow food. An example of a famous person who has it is Diana Cowern, physics girl. There are no known treatments or cures for it either, and there's no way to prove who's most at risk for it, but some risk factors include being female and being a young adult or middle-aged. Okay, I'd never heard of this in my life, and then 3 in a row about it is crazy. This definitely seems like a situation where people would just not believe you listening to the name. Oh, chronic fatigue syndrome? It's on the same lines as exercise-induced asthma, which is real also, by the way. It just sounds kind of, I don't know, excusey. Anyone, or especially even doctors who aren't educated on this, will probably just make matters worse and not believe you. Next story. Parkinson's. I was an EOL home care nurse for a 70-year-old man who passed in January. I watched him go from driving his little white truck every day and only needing physical therapy to unresponsive and bedbound in the span of 13 months. His body just stopped working on him. He was an irritable old man, but he was amazing. He was an artist, and I helped him finish his studio that he'd never get to paint in. I helped him finish a few of his paintings before he lost all ability to hold a pencil. He passed fairly quickly, but up to that point, he lost all control of his motor functions. There's something horrible about losing control of your body and losing the ability to create, something you did every day up until that point. I miss him a lot. We had a lot of long conversations. He loved my favorite band, and I got to keep some of his art. I would do anything to go back to them now. Miss you, John. Next story. Muscular dystrophy. While everyone gets weaker as they get to a certain age range, this makes your muscles deteriorate at an accelerated rate, with you growing weaker and weaker until you can't do basically anything by yourself. Next story, PTSD. I just recently got diagnosed, but have been living with the symptoms for about 7 to 8 years. It's not just the flashbacks, or the nightmares, the triggered reactions where you physically feel like you're back in that event and you're in danger again. It's everything else on top. Technically, mine is CPTSD due to an abusive childhood and relationship when I was 15. Some of my most basic reactions, mannerisms, or the way I do or see things are because of my trauma. Even things as simple as apologizing for every single thing, even when it's not my fault. Not being able to sit in silence or have someone not reply because it makes me feel terrified they don't love me anymore. I am physically incapable of accepting compliments. I just genuinely don't believe people when they say nice things about me specifically. I exist in a constant state of fear and anxiety to the point that it's not that I want to die specifically, I just want it to stop, and that is the only surefire way. Also, any kind of spinal injury. You don't realize how much you use your back until you've injured it. Something as simple as reaching for something twinges a lumbar pain. I have a prolapsed lumbar disc and I've lost around 50% of the feeling in the outside of my left leg. I get electric shooting pain down my leg at random points that start from my hip and go right to the bottom of my foot. If I don't take my nerve pain meds the night before, I can't get out of bed. My back is too stiff and too painful to move, and the meds don't even stop the pain, just takes the edge off. It's exhausting, it's painful, and I'm at a point where at the ripe old age of 27, I've wanted to die because of the pain in my back, just so I don't hurt anymore. Next story. My dad has cerebral atrophy, in particular one called olivopontocerebellar atrophy, where there's no medication to even alleviate symptoms. It's a combination of Parkinson's and ALS with the tremors, musculature atrophy, impaired coordination, balance issues, loss of vision because both eyeballs tremor, starting to lose ability to control bladder, slurred speech. He's only 60 and he's had this for 7 years. I'm his sole caretaker and it's awful to see him deteriorate like this as well as myself mentally and emotionally. Next story. Huntington's. Your brain slowly deteriorates until you're a shell of who you were, and then you die. It impacts your personality, making you sometimes violent, unable to be reasoned with, and unable to take care of yourself. By the end, your loved ones hope you just die, so the good memories of you stop being corrupted by what the disease has reduced you to. I watched it happen to my wife's father, and she's at risk for it. There isn't a day that goes by that I don't think about it happening to her, just terrified that someday I won't love her anymore as I take care of her until she dies. She's going to get tested in a few years, so we know for sure, and can determine if we can have kids without worrying about passing it on to them. Next story. ME/CFS can be pretty terrible, and one of the leading causes of death from it is taking your own life. I'm not even severe, and I've considered it because of the pain and difficulties living with it. Severe ME can cause you to not have the strength to sit up, digest food, move your body at all. You may not even be able to tolerate light or sound or breathe on your own. It can cause brain fog and thinking issues, yes, but you would still be aware of what has happened to you. If you speak to those who are severe ME sufferers, if you hear about their experiences, it is heartbreaking. I have mild/moderate ME and I am very physically disabled by it, but I can still lead a somewhat normal life. I use a wheelchair and go to the store and school and lay at home the rest of the time to recover. But I went into a crash for 3 weeks once where I couldn't even sit up. Lights and sounds hurt so badly. I had to have the room pitch black and headphones on at all times. I didn't have energy to eat much at all and had to force myself to eat and then recover from eating the rest of the day. That really opened my eyes to how bad the disease can be. The best way to avoid it is pacing and resting excessively to prevent becoming severe. Some people have had no choice, though. Some people were severe from the get-go when they got ME. It's like being dead while you watch everyone else go on with their lives, some have told me, and you lose what you had dreamed of in life and have to lay there and think about it all alone, since there is nothing else you're able to do if you're so severe that you can't read, listen to anything, etc. Being so isolated and devoid of the things you love pretty much guarantees depression. COVID and other serious illnesses are no joke either. They're not just a cold. They can make someone very chronically sick for the rest of their life and essentially take the life they had away from them. They can drive someone to taking their own lives, like many ME or CFS patients. Next story. I've had ankylosing spondylitis since 1987. Pardon my negativity. The disease is a literal dream ender. I was 5'11" when diagnosed in 87. I'm now 4 foot, if that. I can walk like an ape if I wanted. My neck is completely solidified, as is my upper back, shoulders, and hips. I happen to live in a state that has a death with a dignity law. I was told that I would never qualify because it's just pain. Yeah, just pain. I almost screamed at that doctor that I'm trapped in a body that's freaking useless. Sorry for the rant. Next story. I have a problem that might not compete with everything here, but I do think about taking my own life quite often because of it. I had a severe brain aneurysm when I was 19, and it took away my entire left side of the body. Imagine being 19 years old and having your whole life taken away from you in the blink of an eye. The aneurysm was so severe that I lost 34% of my brain tissue, and now I cannot remember half of my life, and most of the vocabulary I have now I had to relearn. It caused my immune system to degrade somehow, and while I was in the hospital trying to see if I'd regain movement, I ended up developing MRSA, and they had to replace half of my heart because it had 3 holes in the mitral valve and was pumping blood into my chest cavity, which broke off and went into my brain, causing yet another aneurysm. I now have multiple seizures every single day of my life. I can't move the left side of my body, and I also get these episodes that the neurological team can't explain. In them, I relive the stroke for about 5 hours straight, and nothing shows up on an MRI or CAT scan, so it's entirely in my mind. It's freaking agonizing, and every time it happens, I promise myself I'm going to take my own life if it happens again, but I don't ever get the chance to try because of my limited movement and constantly having seizures. I can't go anywhere because I might have a seizure or an episode in public multiple times per day, and I would need someone to take care of me the whole time anyway. Again, this happened when I was 19. I'll never get to experience what my life was supposed to be like. I don't remember half my life and forgot most of the friends I used to be friends with. I would choose a death at any given time if I could. Next story. Lesch-Nyhan syndrome. It's a rare genetic disease that causes 3 things. 1 is neurological issues including cognitive impairment, similar to cerebral palsy. 1 is overproduction of uric acid with associated gout. The last is a constant and uncontrollable compulsion to mutilate yourself in any way possible. Patients usually start by trying to bite their lips or tongue off at around 3 years old. There's no way to stop or reduce the compulsion to self-mutilate, and there is no cure. Patients typically have to be restrained at basically all times so they don't start intentionally biting their own fingers off or slamming their head into the wall. I don't understand how the brain can even reach this point. What in it tells it that it wants to hurt its own body so badly? Like, that should be, I don't know, in my mind, impossible. Obviously not. But it's just so counterintuitive to any ideas of survival. Absolutely horrifying. Next story. The disease I have isn't really comparable to other things in this thread, but for a while I was in a deep spiral about it. It's a chronic progressive disease. Most people won't improve and will just go downhill forever. I'm in my 30s. I started to think one day that there's absolutely no way I can handle this for another 20 to 40 years. I was thinking recently that some diseases, while way worse, are so final. You know you're going to die, and then it's over. I have still not got my head around how to do this for another 20 to 40 years. Having this as an old person is going to suck. Next story. Stevens-Johnson's syndrome. It's an allergic reaction to medication and your skin melts off. Your lips melt off, your eyelids and orifices weld shut, and you go blind. Your organs even begin to melt. It's agonizing pain until you shut down. My wife had it. It was the scariest thing I'd ever seen in my life. It was like dipping someone in a vat of acid and watching their body just melt. Next story. Actually interesting that I haven't seen scurvy yet. Most people think about pirates when they think about it, and that's it. But in a nutshell, your cells all die and are replaced. This happens even with the cells in scar tissue. With scurvy, new scar tissue cells can't be made to replace the dying ones. Basically, all your old scars open up again. And this is any scar from surgery, any accident you may have had as a kid, and most horrifyingly, you might not even know all the places it will affect, since it happens both outside and inside the body. So, that's cool. Next story. Severe constipation. Okay, now several of you are chuckling. Oh, what a sheltered person that is, you might think to yourself. I've been constipated before, and if this person thinks the pain is so bad they'd rather die, they ain't seen nothing yet. No, I'm not talking about that kind of constipation. I'm talking about severe constipation. Imagine being so blocked up that you can't defecate, but that feeling never goes away. Instead, feces builds up inside your body, filling your entire lower intestines until they reach your stomach, which then gets blocked up in turn. Eventually, feces builds up so far in the wrong direction that they literally travel up your throat and block your airway, ending you by forcing you to suffocate on your own crap. This is a disgusting way to die. One so ugly that your own family won't even mention it, let alone the community as a whole. It's taboo to talk about, so you have to bear this burden alone while you're still alive. And if you mention your constipation, you're scoffed at, laughed at, recommended fake remedies from well-meaning but ignorant people, and altogether brushed off as a weakling who can't deal with a little indigestion. People would laugh at you for mentioning your constant pain and your fear of dying from your condition, even as they don't realize that your own bowels could be dying in sections and going septic inside of you due to fecal overload. They think of your condition as a silly joke, and after you pass, they won't think any differently because they won't know how you passed, because it's taboo to talk about. Due to laws about extending lives as much as possible, people are suffocating on their own feces after weeks or years of excruciating pain and suffering, and nobody's talking about it because it's gross or embarrassing. The system is insanely cruel sometimes. Next story. My grandfather had shingles for 3 years prior to his death. It was so bad that it wrapped around the entire right side of his torso. It was so ingrained in his body that all the nerves in his right arm made it feel like his right arm was stuck in an open flame. He woke up every morning in excruciating pain and only could sleep when he passed out from exhaustion. This was prior to the vaccine. Take the damn vaccine. Next story. Former ER nurse here. I've had several patients beg me to end them. The list begins with things like Huntington's, Lou Gehrig's, ALS, locked-in syndrome. Being trapped in your own body is absolute hell. Bone cancer, pretty much anything that ends you slowly. Things that generally go unnoticed by most people are not the symptoms of the disease that the patients have to deal with, but the effects on life. An example would be teenagers with cancer. Their entire life and social status becomes about their cancer. They often don't date and rarely by choice. Many of them are so lonely. Anyway, I've seen some crap. Enjoy what you have and tell the people that you love them. Next story. Creutzfeldt-Jakob disease may occur spontaneously, be inherited, or be transmitted by contact with infected tissue, such as during a transplant or from eating contaminated meat. The condition causes personality changes, anxiety, depression, and memory loss, usually within a few months. Many people lapse into coma. Because no effective treatment exists, the focus is on alleviating pain and relieving symptoms. I believe it is 100% fatal. However, I'd rather die immediately than go through all that horror. Next story. I currently have MS, multiple sclerosis. All my joints and ligaments will pop out at the slightest. I've dislocated my knees, shoulders, hips, and ankles several times. MS attacks and flare-ups feel like getting a heart attack and a stroke at the same time, while someone punches you in the stomach and squeezes your heart. It feels like a funny elbow and all of your limbs. Our slogan is, you don't get it until you get it. It's because you don't realize how much an MS patient suffers until you have the disease, which is true, because I didn't realize how much pain my uncle was in all the time. So I basically have to fight a Karen every time I have to park in a handicap spot because, "You don't look disabled to me." I'll need a wheelchair sooner or later. I have a cane with me right now. I can't do any of the things that I enjoy anymore, like going to the parks, riding the fun rides. I can't do any more road trips. I could barely walk half the time, and never in a straight line. Every day has blinding pain. So, quite frankly, this disease has got to be at least the top 10 on the list. Next story. Dementia. People say that dementia sufferers don't know what's happening to them. I'm pretty sure they do. Hence the anxiety, the crying, the rage, the hallucinations, the exhaustion, and the terror you see on their faces. Plus, in the US, decent care for someone with dementia has a minimum starting cost of around $4,000 to $9,000 a month. It's often not covered by Medicare, and the cost will increase with time and if the patient becomes more difficult. Bonus for all the family members that spend years watching the person they love suffer every day, or God forbid, take care of them by themselves for years. My mother has Alzheimer's, and after 4 years of dealing with her disease, my mental health is the worst it's been in my entire life. I honestly don't know if I'll recover. Perhaps later in my life I'll get it too, and I can experience the terror firsthand. Dementia is extremely high on my absolutely not list. Losing your mind bit by bit, not being able to remember the people you care about. Even if I don't know what's happening, I don't want to put that on the people around me either. Dealing with it sounds exhausting. I've luckily never been in that position. Anyone who does, people who care for these people or family members who watch over them and do care for them as well, you have my full respect. It's not an easy job. Not at all. I know that. Anyway, that's the last story for today. There's one thing I wanted to say before we end, and there were a few times in this thread where it was like, oh, well, it's not as bad as other things here, and I really want people to not have to think like that. if it sucks, it sucks. That's just true. Perspective is valuable, sure, but it's also important not to minimize your issues just because someone has it worse. Because then you stop respecting the problems that are wrong with you, leading to, other issues, or you feel bad about yourself. It could, a whole bunch of things, basically. So there's no need to compete for who has it the worst. I promise, everyone who said that in this thread, and anyone listening, if things suck for you, you are allowed to say they just suck. Because I have no doubt they do, if you're saying it. Anyway, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.